all along we needed a catheter that has multiple ports, so if one is stuck, so other ports still can inject. So that's a big benefit I see in this catheter. In most of the cases, when we get the patient with multiple back surgeries and we thread the catheter and you come across tons of scarring tissue, you can't thread the catheter, and then you try to inject it through the catheter. Now the tip of the catheter is stuck in the scarring tissue, and with 10 cc syringe, when you push the plunger, you can't push through the dye in the epidural space. I was privileged to first one to use this catheter on any live patient. So the patient has a lot of scar tissues. Clearly remember at L4, L5 junction, injecting the dye was so easy because it was spreading out in 3 ports. Plus the VERSA-XLC has the stylet that go all the way to the tip of the catheter, so it's easy to manipulate in that way. Some of the older patients, some 80 years old, has a spinal stenosis and chronic back pain. They develop some adhesions in the epidural space. It was easy to manipulate, easy to direct, but of course you have to be careful when you make sure you don't go intrathecal space, don't want to damage the nerves, this very sensitive area we're working around. So the visibility of the catheter is much better because of the stylet gauge. Sometimes with the regular catheter, you can't see the tip of the catheter. I have to struggle, especially when you inject even small amount of dye. So with the VERSA-XLC catheter, the tip of the catheter is all the way up, so it's easy to see the tip of the catheter and to redirect the tip of the catheter with a small kink at the end. So in that way, VERSA-XLC really comes handy and easy to manipulate, easy to redirect, easy to see under the fluoroscopy.